Hi guys, welcome back to Codemaster Coach, your medical coding tutor. We're continuing our studies of the 2019 ICD-10-CM coding guidelines, and we are down to C, 2C, chapter-specific coding guidelines. So we're moving right along. Remember to pull out your guidelines, pull them up on the CMS website, and follow along with me because these are your rules of coding. Now, my older videos up to this point are still in effect from 2015, 16, 17, and 18 as far as the ICD-10-CM coding guidelines still stand today. Now where we're at today, we're getting into chapter-specific guidelines is where sometimes changes occur. So make sure if you're studying this guideline next year, for example, make sure you pull out the guidelines and make sure these rules still apply today. But as of today, this guideline we're covering today talks about Chapter 1, certain infectious and parasitic diseases, particularly HIV, stands. All right, let's first review the guideline. All right, this chapter-specific guideline says, first, the intro into the chapter-specific guideline says, in addition to general coding guidelines, there are guidelines for specific diagnoses and or conditions in the classification. Unless otherwise indicated, these guidelines apply to all healthcare settings. Please refer to Section 2 for guidelines on selection of a principal diagnoses. Now we're going to do C1 today. Chapter 1, certain infectious and parasitic diseases. It's in categories or section A00 through B99, human immunodeficiency virus, HIV infection. And number 1 says, code only confirmed cases. And the rule here says, code only confirmed cases of HIV infection or illness. This is an exception to the hospital inpatient guideline, section 2H. And if you don't remember, we'll go back over that. But it says, in this context, confirmation does not require documentation of positive serology or culture for HIV. The provider's diagnostic statement that the patient is HIV positive or has an HIV-related illness is sufficient. All right, Codemaster Coach, what are you saying? All right, the key here, AIDS and other HIV infection. Because HIV has become a major healthcare concern, we must have complete and accurate diagnoses when it comes to HIV. So the code B20, make sure that before you use that code, because remember HIV, B20, the code stands for AIDS, HIV, acquired immunodeficiency syndrome, age-related complex, ARC, age-related conditions, or HIV infection symptomatic. All of those apply to code B20. But B20 is not assigned when the diagnostic statement indicates that the infection is suspected or possible or probable or likely. Because remember that other principal diagnoses for an inpatient says that if it's a suspected or probable or likely or questionable, that we could code it on an inpatient basis, but not with HIV. With HIV, unless it's confirmed, and confirmation, again, does not have to be proof on the medical record of a test that was done that says patient is HIV positive. As long as your provider's statement states that the patient is HIV positive or has an HIV-related illness, that's sufficient for you to use the B20. But the provider should be asked to state the diagnoses in a positive term. So if you're questioning or suspected or it looks like or you've seen on a history of in a previous admission that the patient had HIV, make sure that admission that you're coding for, that the physician clearly states the patient is HIV positive before you code it, and then you can use the B20 code. And on On a personal note, there are some states, California, that you do not apply that code on the chart. It's just a state rule that states do not code B20 on a patient's chart. So watch your state guidelines as well. But again, as far as the coding guideline rules, unless it's positively stated by your physician that your patient has HIV, do not assign an HIV or the B20 code unless it's clearly stated. Okay, guys, that's just introducing you. We'll be going right back into part 2, which is selection of the sequencing of HIV codes. All right, thanks, guys. I'll see you in the next one.